Section 1, Introduction. Congratulations, and thank you for choosing Zoom, the world's #1 in-office whitening system, from Discus, the world's leader in whitening. The Zoom in-office system is one of the fastest ways to whiten. It gets teeth whiter, faster, and keeps them whiter longer. Zoom provides your office with everything needed in one comprehensive system, including patient post-care and maintenance. As it has for thousands of dentists all over the globe, Zoom will deliver stunning results for both your patients and your practice. To support all the staff involved with the treatment, from operator to assistants, we've created this step-by-step instructional video. This video begins with initial setup, followed by pre-procedure and prep, and post-treatment training, as well as candidate qualification and patient expectations. It'll then outline cleaning and storage, as well as some tips to keep you running efficiently. To further support your practice, Discus offers a number of Zoom marketing services and materials that can be customized to your specific needs. To learn more about marketing Zoom to current and potential patients, call your Discus representative today. All of us here at Discus Dental, thank you for choosing Zoom. Now, let's get started. Section 2, Assembly and Setup. Your Zoom lamp will arrive partially assembled within the shipping box. Remove the contents for assembly, including the parts bag. Now, attach the casters to the feet of the lamp base. Then, place the base upright on the floor and lock the casters. Next, place the lamp stand into the lamp base by aligning the pin in the stand with the slot in the base. Remove the bolt and washers from the parts bag and remove the plastic cover from the end of the bolt. To secure the lamp to the base, reach under the base and screw in the bolt. To attach the lamp head, loosen the knobs by the socket at the end of the boom. Carefully but firmly push the lamp head into the socket and tighten the knobs to secure. Place the lamp boom onto the lamp stand by aligning the hole at the base of the boom joint with the stand joint. Locate the screw and Allen wrench from the parts bag. Insert the screw into the joint between the boom and stand and tighten using the wrench provided. Once the lamp is assembled, secure the electrical connections at the joint and the lamp head. Your Zoom lamp is now fully assembled and ready for use. Now, review the contents of your Zoom kit to familiarize yourself with the components. Note the Zoom gel is packaged separately for refrigeration. For maximum results and post-treatment care, the Zoom procedure kits are available with several take-home maintenance options depending on your preference and patient needs. Depending on your region, you may choose from either Day White ACP, Night White ACP, or Night White ACP Turbo. 3 pairs of eyewear are included with the purchase of each Zoom lamp. Make sure each participant wears Zoom protective eyewear. If you need more, contact your Discus representative. Do not substitute with eyewear supplied for use with lasers or other dental lights. The ISO prep retractor provided is necessary to ensure proper positioning of the lamp head and additional protection from the light. The ISO prep is a universal size and will fit the majority of patients. Small retractors can be purchased separately and kept on hand for special cases. Air and water setup is necessary for the procedure. A surgical suction tip is provided and should be used for gel removal at the end of each session to prevent disturbing the isolation material. Section 3, Candidate Qualification and Patient Expectations. Now you're ready to begin the Zoom whitening treatment. First, you need to determine if your patient is a candidate for the procedure. A consultation is recommended to ensure that there are no underlying oral health issues. You may want to treat existing issues before offering the whitening treatment, and you'll also need to disqualify any patient who is perio-involved, exhibits failing restorations, or is otherwise in an unhealthy oral state. To better minimize sensitivity issues, it is recommended to prescribe Fluoridex Daily Defense Sensitivity Relief or another 5% potassium nitrate toothpaste for use 2 times a day, 10 to 14 days before treatment. It's also recommended to prescribe 600 milligrams of ibuprofen 1 hour before treatment. Relief ACP can also be worn before or immediately after the procedure. As with other whitening products, this treatment is not recommended for pregnant women or nursing mothers. We also recommend that patients be at least 13 years of age. Patients taking photoreactive drugs, PUVA, or other chemotherapy should either be disqualified from Zoom or qualified by their physician. Please refer to the instructions for use for additional contraindications. It is important to set realistic expectations about potential whitening results. Explain that results may vary. However, most will experience a 6 to 8 shade change. Anatomy, calcifications, age, teeth condition, and oral hygiene determine the results each patient will attain. Patients with yellow staining tend to whiten best. Patients with severe gray, tetracycline, and/or fluorosis staining will require additional follow-up take-home or further in-office treatment. These patients may experience less dramatic results, but should experience an improvement. Crowns and other tooth-colored restorations will not whiten. To maintain uniform color, tooth-colored restorations may require replacement following whitening. As with most whitening procedures, patients should be informed to expect mild to moderate short-term teeth sensitivity. A mild overall ache is normal and will go away in 24 to 48 hours. Some patients may experience occasional sharp pains during the procedure. These are also normal and will go away in 12 hours. Section 4, Pre-Procedure and Preparation. During the consultation appointment, impressions can be taken for custom-fitted trays. When complete, trays should be placed in the tray case provided in the patient post-care and maintenance kit. Also, during this appointment, the previously mentioned sensitivity protocol can be recommended to increase patient comfort during and after the procedure. The Zoom whitening gels are packaged separately from the treatment kits. To enhance shelf life, refrigerate the syringes. The gel must be returned to room temperature before use so it won't become runny. This can be done by either leaving the syringe out overnight prior to the appointment or placing the syringe in a cup of hot tap water for 10 minutes. Be sure to remove the syringe from the water 5 minutes before use. Enamel should be free of moderate to heavy plaque and calculus buildup. Preferably pumice just prior to whitening. Patients that require root planing should wait 2 weeks before their whitening treatment. Now place the light guide on the lamp. Turn the lamp on using the power button located on the side of the power pack. When the light guide is attached, the display will read Guide Status, Guide Attached, followed by 4 of 4 sessions, indicating the remaining sessions available and total sessions available. Then place the surgical suction tip provided on the high vacuum suction. Apply vitamin E to the patient's lips to moisturize before retraction. Then fully recline the patient and place their protective eyewear. Adjust the eyewear for proper fit and comfort around the ears. Insert the IsoPrep retractor at an angle, retracting one side at a time using a dental mirror to assist in placement. Allow the patient to adjust until comfortable, and then instruct to lightly bite down, applying continuous pressure. Again, the retractor provided is a universal size and will fit the majority of patients. Small retractors can be purchased separately. Take a retracted before photograph using a matched shade tab. To best assess a patient's whitening results, we recommend to shade match teeth with a value-ordered Vita Classical Shade Guide. Document the starting shade in the patient's chart. Section 5. Isolation.